This is EmergencyFD Storyline.
It's crazy to think over the course of just 2 days after I had my exposure, it progressed from something that seemed like, a seasonal allergy or like a really mild cold starting to way worse than the flu. This was just on a different level.
We've had 512 employees that at some point have been off as a result of COVID. Now, with that, 75 of them have been positive, and only 2 are traced back to a patient that we have picked up and transported to a hospital.
COVID-19 on the Frontlines, a Storyline Extra, one firefighter's experience and what that fire department is learning from it. And now they share the experience with you. That is our storyline. The views expressed on this program are from the guests and the host and do not necessarily represent the views of any government agency, private company, or public service. EmergencyFD's Storyline's focus is to tell the stories of those in the fire service and to highlight what matters to our first responders. I'm your host, Tom Mann. Ever since COVID-19 began, since the moment I heard COVID-19, I've searched for the opportunity to share a firsthand experience from someone that's experienced COVID-19 and understand how the exposure happened. More importantly, I wanted to hear from a major fire department and what they're doing to protect their frontline employees and how they adapt to the challenges of this world pandemic. I found that opportunity as COVID hit close to home. Well, some people call him Thomas, some people call him Tom, some people call him Junior, and we call him Russ. With me is somebody very special to me, my son, who is a firefighter, advanced EMT with the City of Memphis Fire Department. Glad you're here.
Hey, Dad. I'm glad to be here.
Why don't you tell everybody exactly what your job is specifically and what you do?
I've worked for Memphis Fire Department since 2017. I'm actually in special operations in Memphis Fire Department. Assigned to Engine 29. I ride Engine 29, Rescue 2, Unit 17, which is an ambulance. And I do that and I also work part-time at a local hospital in the ER.
During this COVID time, have you seen COVID patients, either with the fire department or even in the ER?
Hundreds.
Wow.
Easily.
So, and that's been going on for some time, hasn't it?
And we've been seeing confirmed positives since probably early to mid-February.
You made a statement a couple months back to me when all this began. You said it's not any difference to me whether it's TB, flu. You started naming about every kind of patient that you wind up dealing with. What are your thoughts right now?
I would say that how aggressively it spreads is a little more aggressive, I think, than anything I've encountered. But I'd say as far as like taking precautions, as far as your personal protective equipment you wear on scene, stuff like that, it is the same. It's the same way I would treat anybody else. If I had someone in the ambulance that I thought had the flu, I'd be wearing an N95. If I had someone with that I suspected tuberculosis or they had a history. Now, I'd say it's different just because it's the rate of exposure, the rate of infection, the rate of transmission, and the fact that now I have personal experience with it on another level. So,
how did you get exposed to COVID-19?
The first exposure that we had at my station was actually from a firefighter. He came to work. He was symptomatic, but he didn't really think much of the symptoms while I was out on bereavement. Eventually, he called in sick the next shift. He was feeling so bad. He got tested, came back positive. The very next shift, we didn't find out he was positive until later on in the night. I personally thought if I was going to acquire COVID-19 and be infected, it was going to be through some sort of contact with a patient, whether that be touching the surface that they had touched in the ambulance when we're checking it off, or, which is why I wear gloves, and most of us wear gloves when we check off the equipment. I thought it would be from a patient, but it turns out in my case, that is not what happened. Let's fast forward a little bit. When I came back from bereavement, this is the first time I had contact with any of my coworkers. I worked with 3 individuals that turned out to be positive for COVID-19 later on. They say 2 days, 14 days is generally when you start showing symptoms. For me, it was within about 2 days from my exposure.
So basically, you got it from another family member, right?
That's right. In the firehouse, I mean, we're such close quarters. It's not just, wearing masks inside the firehouse that, helps. But at the same time, there's only so much you can do. I mean, the amount of calls we run, as far as looking at the matrix, my fire station has had a history in the past year of being among the top 3 as far as being the busiest stations, city of Memphis, in the top 3. Until lately, our rescue truck was the busiest. So we're in and out of the firehouse constantly. So we don't really have the ability to touch something and then go, oh goodness, grab some Lysol, wipe it down, and sterilize it, simply because it's not logistically possible. The number one thing we do is we try to consistently wash our hands and not be nasty and not be gross. Be conscious about wiping our face and whatever else, touching our eyes. But that's personally where I think I might have actually had the exposure. I think that at some point I probably touched one of the surfaces that one of the guys, had touched. We're not around all of my my coworkers, my brethren. I don't know what nasty kind of stuff that they're doing, whether someone just picks their nose or, they happen to drool or something and they wipe it off with their finger and then they touch the table and then I touch it later. I'm not going to say it's unavoidable, but it's definitely difficult to avoid those kind of surface contacts.
As someone said to me, it's like sometimes the firehouse can be like living in kindergarten. And people have to understand that. For somebody who's not a firefighter, they would understand it's your second home. There's so much. There's a big possibility of exposure everywhere. You're eating with people. I mean, literally, you have living quarters. And I know the goal is to social distance, but there's only so much social distancing you can even do in your own house, especially everybody's on the job and everybody's running, and it's very difficult. I guess you could say it's understandable. It can be an issue. I've heard this from all over the country and even around the world, people talking about this, firefighters saying, yeah, it's a very tough situation.
I spend a third of my lifetime with these guys right now. So literally a third of the month, a third of the year, I'm with the same individuals. So they are my second family. And yeah, we use the same restroom facilities, we same kitchen, we're in the same areas. And we've generally done a decent job at my station of actually sitting outside the bay and where the trucks are kept. And we sit in, little chairs out there. And that's where we spend most of our time, honestly.
Take me back to the timeline, I guess, after you came back from bereavement. When did you even know you had it, or did you have an indication of it?
It was on a Tuesday. Some of the guys that were there were exposed to the first guy, and he exposed them a week prior. So he had gone off sick and said that he thought he might have COVID-19. So he went and got tested. His test came back relatively quickly, and it did say he was positive. But we didn't know that until Wednesday. So Tuesday was my exposure with the other guy. The first coworker was not there. Wednesday, when we were off shift, a text came out saying from my lieutenants, hey, these people need to be off from work. So there was 10 members that were put off because they had direct exposure to the first coworker. Throughout the course of the next couple of days, we had another member test positive. He was able to go to a rapid testing site and get his results back very quickly. And then 2 other members. One was there on Tuesday working overtime from a different shift. He tested positive. And then one of our drivers tested positive. And then we had a couple more members test positive. The writing was on the wall. Everybody was like, great, it's going to happen. I guess I'm going to get it. On Thursday, I came back to work because I didn't have direct exposure to the first person. I was on the rescue truck the first half, on the first 12 hours. And then when I got on the ambulance, right around probably 10:30 at night is when I just randomly started noticing the effects. I was wearing a mask at the time. Now, it was a surgical mask inside the cab of the ambulance. My paramedic coworker was, typing up the report, finishing up his patient care report. And I just noticed out of nowhere, just flashed sinus drainage, like out of nowhere. It almost like, it felt like I got a nosebleed and it was going down the back of my throat. That's how rapid, quick it was. But I realized it was sinus drainage. And then I started getting a pinpoint headache, right? It was like a sinus tension headache almost right over my left eyebrow. I immediately switched to my N95 mask. I looked over at my friend. I said, I need to go home. He's like, why? I said, I need to go home. I actually think I might be getting symptomatic. I'm not even joking. To put this in perspective, okay, we're around these communicable diseases so often. It's easy for first responders, nurses, police, everyone involved in the first contact to get complacent on it and think, well, I haven't gotten exposed, or, I haven't gotten it now. So I've been around these people hundreds of times. Evidently, you must just be doing a decent job at wearing the proper PPE, because we were sitting there joking about how I didn't get it put off initially because I didn't have a direct exposure, but then I start getting symptoms. So immediately when I noticed I had symptoms, I put myself off on sick. I left. I went home. I had an extra N95 and I have gloves sitting around the house because I do automotive work. So I have surgical gloves that I use, when I do that kind of stuff. So I came home. I gave my wife a warning. I said, when I get there, I'm going to the bedroom. You need to get out, go somewhere else. And I put a box of gloves, an N95, and I said, every single time you come in this room right now, I want you to wear this N95 and I want you to wear gloves. For whatever reason, you got to come in there. That was that night. I didn't take any sort of over-the-counter medication the first night until the next morning.
You're now quarantined, and you're letting everybody know, stay away. Girls, your two girls, they're not around either. Everybody's out of your domain at this point. You've taken over the bedroom. So
yeah, I didn't lock the door, but there was clear instruction. I have a 6-year-old and I have a daughter who's about to be 3, and there was clear instruction for both of them not to even go in the room. And they're generally pretty good at this sort of stuff. They're both smart. And Mommy just explained that Daddy was very sick. Don't go in there or you will get sick too. So yeah, isolation is the number one thing you can possibly do.
So let me take this point. You have it as the day or two progresses. Tell me a little bit about your symptoms. They came on suddenly, right? Just out of the blue, just boom, they hit you.
And they started mild. I would describe it as like a seasonal allergy almost. People get sinus tension headaches just from allergy season. So that's how I experienced it initially that first night. But I knew better because we had already had confirmed, positives among the coworkers. It wasn't until the next morning when I woke up. I woke up with just this massive headache. I had body aches. I was having joint pain, muscle pain, sore throat, just everything all at once. And it wasn't like that when I went to bed the night before, but it progressed. By the time about 8 hours passed, I was feeling horrible, absolutely terrible.
You were talking about joint pain. You were a relatively very strong guy. This was bigger than the man flu, wasn't it?
Yes. So the infamous man flu that I always joke about is myself and most other men I know of were down and out for the count. We're in the bed. We're miserable, not doing anything productive. Just, big babies. Help me. And that is absolutely how I felt, except this was the worst I'd ever experienced. It's crazy to think over the course of just 2 days after I had my exposure to my coworkers, it progressed from something that seemed like, a seasonal allergy or like a really mild cold starting to way worse than the flu. And I've had the flu 2 or 3 times now in my life. And this was just on a different level. Before I took Tylenol, the highest temperature that peaked for me, an oral temperature, was 102.8. And immediately said, okay, I need to go to a testing site and get tested. So that was that morning. So we're on Friday morning, right? night. This is the morning after I started noticing symptoms. I I wore gloves. I went alone in my vehicle, wore an N95 the entire time I was in the vehicle. I drove to a different county, actually, to do the testing because I had heard that a lot of the labs in the area were behind on the testing. So I wanted to get a little bit quicker results. So I drove out to this other county. It was about a 45-minute drive. Got my swab done. When I pulled up to the line, I kept my windows up. When the individual was a volunteer, I think he was from the local Army National Guard, he came up to the window. I immediately told him, hey, there's a very good probability that I'm COVID positive. So I'd like for you guys to take care. But he asked, how do I know that? And I said, well, I've already had 4 coworkers who've come confirmed positive COVID, and I'm experiencing the same symptoms. Got my swab done, went back home, went back to sleep. Basically, it was survival. I didn't eat much. I was trying to drink enough water. I was miserable.
So any other symptoms other than the ones you described? You said the body aches were really bad.
Body aches were awful. 2 days after I started experiencing symptoms, my fever was under control. It was upper 99, a little bit below 100 degrees Fahrenheit, but I was having back pain. All of my joints hurt. I mean, I thought to myself, I wonder if this is what it's like to have rheumatoid arthritis, because everything hurt. I have a history of doing powerlifting, and I used to squat 5-6 days in a row throughout the week, high intensity, hard preparation for powerlifting competition. So, I mean, I used to experience some joint discomfort then, but it wasn't like this. This was like an internal ache. It was, there was something inside my joints that was inflamed, that was swelling up. Now, I wasn't visibly swelling. I didn't notice that, but there was just pain. And my muscles, every muscle, mostly my legs, but my arms experienced it too. I wouldn't call it a twitch. It's more of like an involuntary contraction, almost like minor cramps, but they were constant. It was just jittery, very difficult to relax, anxious. My neck was kind of stiff. It was more lymph nodes down here. I didn't have a cough yet, and that's something I never really experienced. I didn't experience any respiratory issues. And possibly it's because, I didn't have any pre-existing conditions. Maybe I noticed a productive cough probably around day 6, day 7, but I never had any real difficulty breathing or shortness of breath. I would say I was zapped of energy. There was one point where I tried to move a piece of furniture inside the room so that I could sit in a chair. Instead of laying in the bed all the time, I went to sit in a recliner. And when I did that, I got out of breath pretty quick. But it wasn't like a shortness of breath. It was like if I was to overexert myself, running or something along those lines. It's so just real weak on energy. Probably the most sad symptoms that I experienced were day 3 for me. My taste and my smell completely gone. Strangest experience I could ever describe. You don't understand how much you appreciate taste specifically until you can't taste anything, and you could pretty much probably drink mud and with no difference. But I can't complain really about the loss of smell. That's okay, for certain aspects. But
sounds like a firefighter. I'm sorry when you said that. That sounded just like a firefighter.
That could be a superpower in my line of work.
Yeah, that's true.
Loss of taste. That kind of put me in more of a dark, depressing state. Because it's like, okay, well, now I'm already in this, awful experience. I feel horrible. Everything hurts. And now I can't taste anything. Great. Awesome. Because it was awful. I've never been so sick in my entire life. I was down and out for the count. And there was at one point, I think it was the 5th or 6th day with my experience, I was like thinking to myself, I need to go to the ER. I just feel awful. But then rationale, I work in the ER, And I thought to myself, well, I'm not life-threatening. I'm not going to die from this. I don't feel like I'm going to die from it. I don't need to take up a bed in the ER if I'm not that critical. And they're not doing anything that I wasn't already doing for myself. Yeah, I was miserable. I felt awful. I was anxious, restless. My whole body hurt, muscles hurt, back hurt, joints were killing me. But it wasn't anything at any point that I felt was life-threatening. I just felt like it was an awful illness. And the interesting thing that I would like to say is the youngest person among us that tested positive actually was hit just as hard as the rest. None of us really experienced actual respiratory problems, fortunately. Everybody pretty much experienced the same things. Now, the timelines of when we experienced certain symptoms was different. And that's something that's unique to everybody. But the first individual that tested positive, he still is having issues. I don't think his strength is completely returned. I'd say that looking back, probably day 11, maybe day 12 for me was when I started to actually feel like I could be a functional member of society and actually walk around. And, I was still isolating myself, but I'm just saying that that's when I felt like I wasn't completely zapped of all movement. My strength is starting to return. Still can't smell anything. My taste is back. Something that's unique that I have experienced post, COVID is I am way more sensitive to allergies. I've been breaking out with hives almost every single day. I'm pretty sure it's from my dogs. I have 2 huskies. I've had a mild allergy to them. That's been told me by an allergist. It's also something my optometrist brought up. Perhaps because my immune system is lower now, recovering, or some other mechanism of action. There's been some literature that I've seen about certain types of corticosteroid shots, like methylprednisone, which is Solumedrol, or maybe a Z-Pack or something that could help return your immune system, and then you stop experiencing. But this is one of those symptoms that I'm not alone in experiencing, but it's not something that's well known, and I think a lot of people just don't associate it with COVID. But your immune system is so weak afterwards, you have to be more careful.
Immunity. Nobody really 100% knows about it now that you're on the other side. How do you feel about it now?
So if you have a strong immune system, a lot of times you can actually contract certain things you would never even know because your immune system's strong enough. You don't get a fever. You might feel a little bit strange, but you may not notice you actually have some sort of viral infection. Some people, my wife would be one, that pure Russian blood.
We joke about that quite often. She never gets sick.
We do, but it's a real thing. And it's possible she's gotten corona from me and we just don't know. It affects people differently. When it pertains to COVID-19, a lot of the literature is saying that you do acquire some sort of antibodies to it. Most people do, which if you have antibodies to fight it, that means immunity. The question is, how long is the immunity good for? Nobody's really too sure of how long your immunity will be. We don't even know if, a vaccine, an effective vaccine was put on the market. We're not sure how long the effective immunity is going to be with that vaccine, or if it's just going to kind of take the edge off. But for the most part, even from my personal experience, if you take the flu vaccine and you acquire a different strain, the symptoms are not as bad as they would be if you didn't have any sort of vaccine or any sort of immunity to other strains. If COVID-19 does mutate, this will reduce the symptoms. I would absolutely love to not experience the same caliber of symptoms.
I understand there's some directives that have been put out probably since this, and I would say maybe you guys were instrumental in that. Your group, your crew, is that right? That's what I think. That's my opinion.
Yeah, we are a bit famous at the moment. The number one driver for revised policies is somebody doing something or something happening that proves that the current policy is not necessarily effective, or that they need to re-implement a stricter policy. So I'm very fortunate that I work for one of the largest fire departments in the country, but more importantly, I have a command staff that is truly there to support us. The equipment they've brought us over the past, 3 or 4 years is second to none. And then at the same time, the policies they've implemented. They have anti-cancer policies. They already had a pretty good on-the-job, injury and exposure policies. So they were already pretty ready for this sort of thing that we experienced, the COVID-19.
What are the lessons you've learned out of this?
Number one, it's real. I say that because I have seen people pass. I've dealt with them in the hospital, and that's the setting where I generally have actually seen some patients go from talking to you and then, 6 hours later, still on your shift, they crash, they die, they go into cardiac arrest, and they die. I knew that the coronavirus, COVID-19, is a real deal. So I would simply urge all of my brethren out there, first responders, nurses, doctors, do what you're supposed to do, follow the policies. Take this seriously. Wear N95s. Wear eye protection when you have someone who's actively coughing. Take it seriously, because the last thing we need is for a large number of frontline workers to be put out because they've acquired this. We know what to do. Just do it.
Russ, thanks so much for it. And again, I appreciate you being pretty candid, pretty open. I think you make everybody proud.
Anytime, Dad.
COVID-19 is real and presents challenges to fire departments across the world. And working through those challenges is what our next guest shares as we continue our storyline, COVID on the Frontlines. With me is Robbie Franks, Division Chief of Safety and Wellness for the City of Memphis Division of Fire Services. And Chief Franks, I figured you're real busy right now, aren't you?
To say the least, Tom. It's tasking. It's the everyday duties of what we do here and trying to take care of our employees. And then now with the added ambiance of the COVID and trying to put things in place to take care of our people and make sure we're doing what we need to do to keep everybody protected. It's been a full-time job. So we keep moving one foot at a time forward.
We're going to get into some of those specifics in just a moment. When you're not dealing with COVID, what else do you do?
So my typical job as the Division Chief for Safety and Wellness is I oversee two bureaus, the OSHA Bureau, just our daily health and wellness of our employees, on-the-job injury program. That's primarily the biggest bureau I oversee, as well as our air mask, which is the operations of keeping our SCBAs, which is a main protection for firefighters, as you know. I oversee that bureau of the air mask mechanics that keeps that moving daily. So that's my two biggest things. But over the last couple of years, we've also, as health and wellness, we've tackled the new cancer initiatives in the state of Tennessee. Very fortunate for firefighters this past year, passed the presumptive cancer law.
Yeah.
So that's an employee's benefit of now if something happens, the employees got protection. Put a lot of things in place. We've introduced a health physical program where we allow firefighters to go on duty to get a physical yearly at no cost. So we've really kind of tried to tackle fitness and now, like I said, we deal with this thing called COVID. So it's involving every day, but it's been a blessing. And and at the end of the day, I know we're taking care of our people. We got great leadership, so we'll tackle it one day at a time.
Well, a little bit earlier, we were talking with somebody I know well, my son, and I'm going to tell you, I guess his group is a little famous right now. And as we talk about COVID, that is a great example, the challenges to the department. So tell me a little bit about talking about that situation and how you guys have adapted to some changes and what you've already had.
And I tell you, that's a really good question. And, your son's group, first of all, that group, they're in the special operations programs. They go through, additional training, a lot of extra stuff from your structural collapse and hazmat. And they're, they have a lot of specialty backgrounds. So they take on a lot more than just your routine work. But I tell you, it's been evolving. When this started in March, between now and just to give you some numbers until I get into your son's situation at Fire Station 29, we've had 512 employees that at some point have been off as a result of COVID. Now, with that, 75 of them have been positive, that tested positive, and 437 have been quarantined. Now, most of that, believe it or not, has been exposure from another employee or from a family member. We have tracked this. We have a spreadsheet with charts, and we track this daily. We've only had 2 employees that are traceable right now that has been the result of a patient contact.
That's shocking to me. I mean,
Yes,
just you know what I mean? But
yes, sir.
yeah, go ahead with that. That is
As
neat.
as the mayor the other day asked Director Sweaty, he was basically, is that correct? And said, yes, we've had 75 employees test positive, and only 2 are traced back to a patient that we have picked up and transported to a hospital. The other 73 are either been from employee to employee or family to employee.
So the situation, like even with my son's group, that unit, that is not that surprising then.
No, and I tell you, we've had a few stations, and I use the word shut down. We have not had to close any stations. Luckily, being a Metropolitan Fire Department, when we've had to send groups home, we have the staffing to bring people in. So at no time has the station been shut down, but we've had to send groups of members home from other stations. The unique thing about your son's station was, in the past, once we sent that group home from that same particular shift, there was no carryover on the other shift. Your son's station at Fire Station 29 was a little bit different and a unique challenge because it started out on the A shift. Then it affected the C shift.
Oh, wow.
Then not entirely the B shift, but even some from the B shift. So that was the first time that we witnessed that all 3 shifts was affected by it. And it basically, we had to restaff a whole fire station. Now, what led to that, though, if you go back prior to when we first started this process and we were following the CDC and the Healthline guidelines, it's not closely, in most cases, we were exceeding what they were saying needed to be done. Early on, we were using the policy of social distancing and wearing masks when you couldn't social distancing. And early on, it worked for us. Once the issue hit and we had the widespread at Fire Station 29 that affected your son in that group, it made us have to kind of take back a look and say, all right, what are we doing? What can we improve? From that, because of the exposure between the houses, now it's masks are mandatory at all times. Basically, outside of you being in your private sleeping quarters at night or you're eating dinner, masks have to be worn. And that's all over the city facilities. It's like anywhere else. We're doing temperature checks. That's happening twice a day at 0700 in the morning, at 1900 in the evenings. Masks are being worn the first day of each set that you report to work. Each employee's issued a new mask just in case they need it. We've provided the N95 masks. We've provided masks that are produced by our local uniform company that have Memphis Fire on it. We've even kind of gotten away from traditional fire department deal where you have a certain uniform you have to wear, because of the importance of making sure our employees are masked up and the comfort of understanding some masks are not as comfortable to others depending on how they're made. We've pretty much allowed employees to wear any type of mask as long as they're masked up. If you want to wear your Atlanta Braves or your Alabama Crimson Tide, that's okay right now. Just mask up. We're good with it. We're so into making pro mask that we don't care if it says Dallas Cowboys.
Even in Memphis.
Yeah, even in Memphis. Hey, whatever works. When it first hit, we had the travel policy where those who were coming back from early spring break were automatically quarantined. We've kind of gotten away from that because just about anywhere now is considered a hotbed, any major city. So you going to Florida is not increasing your chances of getting testing positive if you walk down the street of the city of Memphis not wearing a mask. So we've kind of evolved from that to where travel is no longer a problem because your same likelihood, if you're not doing the right things of masking up and social distancing, are here inside our own hometown as is if you go to Florida or Atlanta, Georgia for the weekend. So that's some changes we've seen from the travel standpoint.
I don't know, it's really hard in the fire service because you got, as my son was mentioning, 1/3 of his time is with that family, his second family in that fire department. And like he was at the 29s, it's different. It's just totally different because you are eating together. You're doing all these things that you would do in your own home. And so, it is different. What are some of the biggest challenges you're having to deal with?
We haven't faced some of the challenges of PPE like a lot of places have. Our biggest challenge has been more from the standpoint of once we have an employee either test positive or they were exposed to a family member that tested positive, has been the documentation that's required to return to work. For us in the city of Memphis, if you're off for any type of illness, not COVID related, and you miss, so much time, you have to provide a physician's release saying that, you were under our care. Obviously, like a lot of places, and now you can come back to work. Well, with the COVID is most of that's dealt obviously through the health department. And once you've tested positive or you're exposed to somebody that's tested positive, it's all through the health department. Most local doctors are not going to see you once they know you either tested positive or your family member did. So it's been trying to come up with a system to where we know, okay, the employee has made the 14-day criteria that the health department has put in place. They're 72 hours symptom free. Can they come back to work once they've met that criteria, or do we require them to get a release from the health department, which they're so backed up, maybe 3 or 4 weeks? Well, from our standpoint, even in a large department like ours, and we've been lucky that that we've been able to staff everything, we still have budget issues and constraints when it comes to staffing. So we've had to kind of readjust our deal when it deals with COVID on if an employee produces the letter that shows they have to be quarantined these 14 days. Once those 14 days are up, we're allowing them to come back to work long as they're symptom free without the release. If in other words, they may be off 2 more weeks, and that's even tough on us to have an employee off a month just because they're not able to get a release. So we've had to kind of change how we go about letting employees come back to work.
Yes, my son was talking about when he had the challenges of testing. Is there any way that can be sped up or anything, or is that a potential for the future?
That's an ongoing problem, I think, for most. And I tell you, and this is somewhat a different question what you're asking, but early on, it was just also being able to get a test, period.
Yeah.
So we were able to meet those challenges to where we had some opportunities that developed early on through Baptist Hospital here at Baptist East, and we provided it to all the employees. Now, I'll be honest with you, we found out once we offered it, even through the union was supporting it, the administration was supporting it, we had less than right at 25% took advantage of it. And this was an on-duty deal, so we wasn't asking you to go off duty. We have sent everybody out there, and only 25% of our employees took advantage. And that we were all like, why are people not wanting to do this? And there were some different issues that we tackled and looked and thought, what can we do to improve this? So we went back to the drawing board and without making things mandatory, because that's not something we feel like we can make mandatory. We can highly encourage. So we come back about a month ago, and we offered it a second time with a little bit more education behind it and the reasons why you should consider it for you and your family and protection. And the second go around, we had a really good success. I'd say close to 85% took advantage of the testing, which was us. Hey, when you're talking 1,700 people to get 85% to do it, that's pretty good numbers. The unfortunate part, Tom, that's a little bit out of our control that you were initially asking about is all these tests, typically, you either get the rapid tests, which are hard to get, or you get the test that has to be sent off. We've run into the problem just like everybody else in the general public. We may be able to get an employee tested today. No problem. We can get you tested. But the same, whether I get you in today or next week, they're all going to the same lab. And that's where the problem is. Only so many labs in each area have the authorization and the things to be able to test this and run these tests. So the problem of backing up is at the labs. And so once the lab gets to you, that leads to delay to get back to the health department. It leads to delay to get back to the employee, which leads to delay to get back to us to let us know the status of what's going on. So I don't know if there's anything we can do with that, because it comes back not to get on the labs. I'm not getting on them.
Right.
I mean, they're overtasked as well, but that's where the underlying problem is right now.
The other thing is, you said that, I thought, I've had that nasal swab test, and good grief, I don't want to have that again. I mean, that's like going that to the back of your brain. So maybe that's why you got the 25% in the beginning there. But yeah, that is an ongoing issue. But I think you guys have that challenge with the fact that you're able to get your employees to go back to work. And most of them know when they're symptom free. You're dealing with people that actually are used to understanding a lot of mechanisms of sickness and illness. So I think that's the good thing about that. You touched on this a moment ago. You're fortunate you have a large resource of employees, so you can staff. How is that for departments that are not the size of Memphis? Can you tell me a little bit about that, just from what you know?
The few I've talked to so far have been very, very fortunate that they hadn't had an issue yet. The one case that I can talk about, that I would say I feel comfortable talking about, was we had one outside of St. Louis area, and they had a deal where they had to put 3 employees off. And when you talk about a department, it's 2 stations, 17 employees, and they only run 3-man companies, which in Memphis, we run 4-man companies. Well, you lose 3 people, and some of that's even considered like a combo department with volunteers. I mean, you can be in trouble real quick. when you start losing 3 and 4 employees that have tested positive or off quarantine, when you're already in a very limited staff that you can pull from, and you're relying on volunteers who, the volunteers are great thing for this country. But even in times like this, which you read and you look around and you talk to different people, volunteer numbers are down right now. But now you've added the COVID. So now that's added another thing, that people that normally would volunteer, a lot of them are, taking a back seat and say, maybe this is not for me. So anytime you have a situation that you lose 2, 3, 4 employees, it can dramatically impact your fire service in your community.
You constantly have to adapt with COVID, correct?
We currently have 44 employees off. We have 22 that are currently off because they tested positive, and we have 22 additional that are off for quarantine reasons. So a total of 44. And if you just look early on from where we had, and we've had some peaks and valleys of numbers, spiking and going down. But to be in August and this still be an issue across the country and even inside the city of Memphis, I think right now, knock on wood, our employees are doing the right thing. They're doing the things that we're providing in the PPE and the education. They're trying to follow that as closely as possible. They understand that things changed from early on. We had the CDC and the health department said 14 days and 72 hours. This is what was required if you were tested positive or exposed. Then it changed to where if you tested positive, it was 10 days and 72 hours. But if you were exposed, it was still 14 days and 72 hours. To now, it's if you test positive, it's 10 days minimum, 24 hours symptom free. Still 14 days for those who are exposed. And the reason anyway, so why would you be off 14 days if you're exposed versus 10 if you tested? Once you've tested, they know you're a carrier. And now it's let's get you past this 10 days and 24 hours symptom free, and you're no longer contagious. And with that being said, just our employees understand that we are keeping them up to date daily, to the point that some of them laugh, we're giving them too much. There's too many memos coming out. But I would rather hit them with more than not enough. So we're doing enough and putting stuff out, keeping them informed, keeping it very open and transparent. And as a result, I think that's why you see right now our numbers are fairly low and how it's impacting us. Now, could that change tomorrow? Well, we may have to come out with some different things, yes. But right now, just from the evolving of when this started in March time, we had the thermometer that I'd have to put on your forehead. And when I was done, I'd have to get an alcohol swab and wipe it off. To where now every station has thermals that you can at least handheld, to where in the last week we haven't gotten them everywhere, but we got the training center, fire administration, OEM, all of our bureaus got them now mounted on the wall that all you got to do is walk by. So that's another thing we're evolving to. We're trying to get less and less anybody having to touch something.
Advice for the fire service around the world, what would you tell them?
Tell them that, we all have the mentality that we're just old firefighters, and that's what we do, that this is unlike anything we've seen before. We're having firefighters pop up daily across the country that are dying as a result, being exposed to COVID and testing positive. We're losing brothers daily. Please mask up. Please put your mask on. Please practice social distancing. Do it for you. Do it for your family. It may not affect you, but even you as a carrier, you may take it home and it may affect a loved one. Take care of yourself. Wear your protective equipment. And let's keep moving forward.
Well, Robbie Franks, the Division Chief of Safety and Wellness for the City of Memphis Fire Department, thanks so much.
Tom, appreciate it. I appreciate the opportunity to be here. And on behalf of the Memphis Fire Department, we appreciate what you do as well for us and for the fire service across the country.
COVID-19 on the front lines. Just a reminder, there are many ways to listen to EmergencyFD Storyline, the podcast. You can find it on Apple Podcast, Google Podcast, Spotify, Stitcher, Deezer, Podchaser, Podcast Addict, iHeartRadio, Buzzsprout, and more. If you would like to contact EmergencyFD Storyline with comments or suggest a story or subject for an upcoming podcast, email us at storyline@emergencyfd.com. That email address again is storyline@emergencyfd.com. And also don't forget to check out our website at emergencyfd.com. That's emergencyfd.com. I'm Tom Mann, and I want to thank you for listening. There are many stories coming on EmergencyFD Storyline. Join us.